You were kind of kept in this area that was completely plasticed off. You were curtained off. You couldn't go and see anybody. Only the nurses came in or the doctor came in.
It was Maria Nichols' worst nightmare. Just days away from her vaccine appointment, she ended up in hospital isolation with COVID-19 as her concerns for herself and her husband, who also had the virus, grew.
Am I going to end up taking him to emerge because he needs a ventilator? Like, we both had the same concerns and the same fears that, it's going to get worse. And I consider myself very fortunate that it didn't.
But so many others were not so lucky. Manitoba's ICUs are seeing unprecedented surges of patients. Over the weekend, the province hit another unfortunate record milestone. 30 COVID patients were admitted to ICU within a 48-hour period.
It's disappointing, discouraging to have these numbers so high. It's exhausting and it's stressful. So we worry about sustaining them long term.
And it's becoming impossible to keep up. So far, 40 Manitobans have been transferred out of province for care in Ontario and Saskatchewan ICUs.
The intensive care unit staff is completely exhausted and especially mentally exhausted to move a number of patients per day, which is unheard of for us in our intensive care, to ship out of province, more than one person a day. So the whole endeavor is really very taxing and quite extraordinary.
Doctors have been calling for a complete lockdown to not just stop cases, but help healthcare workers who are on the brink of breaking down.
We have absolutely overtaxed our ICU staff. I shudder to think of what happens if some of them start to give up because they're really, it's been a long haul.
One that right now has no end in sight. Brittany Greenslade, Global News, Winnipeg.